Hello, my name is Abdul Momin and I'm a registered dietitian nutritionist and a public health professional. So today I'm going to tell you the difference between signs and symptoms because this is one question which a lot of people ask me being a healthcare provider. And even if you are not a healthcare provider, even as a common man, you should know the difference between signs and symptoms because quite a few people use these terms interchangeably, which is actually wrong. So whenever we use the term symptom, it means that it is an effect which is experienced by the particular person or by the individual himself or herself. And when we talk about the sign, it means that it is the effect of a health problem which has been detected or observed by someone else, and that someone else generally is your healthcare provider, whether he is the physician or the nurse or the dietitian or XYZ, any healthcare provider. So basically, what you need to understand is that the difference between these two terms is that of the one who is detecting the particular effect of the health problem. Let's take the example of pain in a body part or fatigue. So when we say when a person says that he is suffering pain in the neck, say for example, or somewhere else around the knee area, so that pain can only be described by the person, by the patient himself or herself. Similarly, when the person says that I'm fatigued, so that effect can only be observed, only be experienced by the person or the patient himself. Same is the case with the nausea. If someone says that I'm feeling nauseous, so that nausea cannot be detected or measured by someone else. There is no scale on which you can measure the nausea of a person. So these are all examples of symptoms. Now when we use the term sign, so say for example, if a person vomits, that is a sign because this is something which the healthcare provider or someone else can actually detect and observe. Similarly, when we talk about temperature or when we talk about the blood pressure, these are again the examples of signs because these can be observed or detected by the healthcare providers or someone else. So this is the basic difference between these two terms. Now, what is the benefit of signs and symptoms? So basically, signs and symptoms help you communicate. In fact, your body is communicating to you through signs and symptoms that something is not really right and you need to look after your health. So that is the major advantage of signs and symptoms. There are certain conditions in which signs and symptoms of a particular disease do not appear. That is a separate topic and I will cover it in a different video. But as of now, do remember that signs and symptoms are very important in communicating that something is not right with you and you need to be really cautious about your health. Sometimes there is a case when a few indications can be classified both as sign and symptom. So for example, when we talk about a rash is something which can be observed by the patient or the particular individual himself or herself, as well as the rash can be observed or detected by your healthcare provider or your physician. So in that particular case, the rash becomes a symptom as well as the sign. So I do hope that you are now very much clear about the difference between signs and symptoms. For more informative content, do keep watching my channel. Press a bell icon if you haven't pressed till now. Like my video. Let me know through your comments if you have liked the content or not, and most importantly, share my videos with maximum so that others can benefit as well. Until next time, it's bye bye from my side.